Ebola virus is one of the most dangerous diseases in the world, known to cause severe bleeding, organ failure, eventually leading to death. While addressing journalists today at the Ministry of Health headquarters, the Permanent Secretary in the Ministry of Health, Dr. Diane Atwine, confirmed the outbreak of Ebola in Mubende district, which is found in western Uganda.
On the 15th of September 2022, one suspected case of viral hemorrhagic fever was identified and isolated in Mubende Regional Referral Hospital. The patient was a 24-year-old male who lived in Ngabano village of Madudu sub-county in Mubende district. He was a referral from St. John's Medical Clinic in East Division of Mubende municipality, where he had just been referred on that day.
According to Dr. Diana Twine, authorities from the Ministry of Health are probing other 6 suspicious deaths this month. The deaths in question have also taken place in Mubende district as well.
Only one confirmed death. The rest were community deaths, which were in the cluster of one same family. And since they were buried, we cannot say these were confirmed. As Commissioner Allen said, it is suspected because this particular confirmed case was part of that family. And so we have high suspicion that most likely but we cannot say they are confirmed.
Dr. Baya Fatumbi from the World Health Organization has advised members of the public to practice prevention and countermeasures because there are no vaccines.
Done something before in DRC, but we found that the ring vaccination that worked with the Zaire virus will not be useful for this particular Sudan strain. But there's another type of vaccine, Johnson & Johnson, that is being tested currently and see whether it will be useful for this particular strain. But prevention, like the Permanent Secretary mentioned, is better than cure.
Health workers have also been urged to have the highest index of suspicion and to also maintain heightened safety precautions.
For any suspected case, we encourage the public to call on our toll-free. I want to share this toll-free. It is 0800 1000 66.
Ebola symptoms start to show 2 to 21 days after contact with the virus, with an average of 8 to 10 days. The cause of the illness typically progresses from dry symptoms such as fever, aches, pains, and fatigue, and then progresses to wet symptoms such as diarrhea and vomiting. According to the Center for Disease Control, the Ebola virus was discovered in 1976 near the Ebola River in DRC Congo. Martha Amanya, CTV, PM Edition.
Well, that is the latest from the Ministry of Health. Of course, they have given us their toll-free line, and that is what you can use to contact them in case you get any or feel any symptoms or signs of the Ebola virus. And joining us at the moment is Mr. Emmanuel Ainebiona, and he is the Public Relations Officer from the Ministry of Health, and he will be giving us an insight in regard to this Ebola outbreak at the moment. Good morning, Mr. Emmanuel.
Good morning to you. How are you?
Fine, thank you. Thanks so much for joining us this morning. Well, what is the latest in regard to the Uganda's 5th Ebola outbreak?
Thank you very much. We have teams who have been dispatched to the affected area, which is in Mubende, following the confirmation of the case. We have mapped out all the 10 districts that are neighboring Mubende, and our rapid response teams are on the ground. They are doing contact listing, and also we have ensured their supplies to the health facilities to enable, for instance, Mubende Regional Referral Hospital set up an isolation and ensure that all the health workers have the protective gear as required while handling or treating patients who present with symptoms consistent with the Ebola virus.
Well, one person has been confirmed dead, a 24-year-old man, but at the moment, are there any increases, in the cases?
As of this morning, we are still waiting for a report from the teams that were dispatched on Friday. So I think I will be having updates a bit later in the day, follow after the incident management team meeting. So I'll be able to know if there are any contacts that have been listed, if there are any of the contacts who have been admitted, or how many are in the isolation. That details will come in a bit later today.
Well, what are some of the mitigation measures that the Ministry of Health is putting in place to ensure that, they curb this Ebola outbreak?
Yes, first and foremost is to have effective case identification, that is listing contacts of these people, then creating community awareness through communication, ensuring that people know the symptoms of case definition. What does, for instance, an Ebola patient present like? And once the community is fully sensitized through mass media and social media, we shall be able to get people reporting any case that is within their communities. Then another aspect is to ensure that people, if someone dies of unknown illness, ensure that our medical teams accord a safe and dignified burial. So people should not be involved in handling bodies of their loved ones who they don't know what has caused their death. And that's why we are going to issue a number of standard operating procedures or guidelines on how to go about many aspects, but also people have to ensure that they maintain good hand hygiene by and also disinfecting belongings of people who present with Ebola-like symptoms with JIC, and that is mainly some of the aspects we are handling now. We have teams in the districts of Chivoga, Kakumiro, Chankwanzi, all those districts that surround Mubende, and all teams are now working with the district task forces to ensure that they check their readiness in terms of responding to the epidemic.
Mr. Aineviona, you're speaking to Shivana. Earlier on in our discussion in the first part of the segment, Agi and I were actually talking about some of the prevention mechanisms or what you can actually do. And you mentioned JIC, but let's take a look at our economy. I mean, how many people can be able to afford JIC to be able to disinfect?
No, this is largely used in the isolation points.
Okay.
In our homes, we have to ensure that we quickly identify anyone, report this he or she to the nearest health facility for our teams to ensure that these people are very well isolated at a designated facility, and also help in disinfection. So what we want to know, the population to know, is just to know how the disease prevents, and also know that we have to avoid contact with body fluids, sweat, blood, vomit, such that we do not contract the disease, because this disease is mainly spread through body contacts with the body contacts and fluids.
But maybe something that would be of concern, unlike COVID-19, when it comes to the Ebola virus, which age group, does it have a particular age group that it affects this particular age group? Who is more at risk of contracting the Ebola virus?
With the Ebola virus, every age group is at risk. And Ebola kills in just a few days. It's unlike COVID, where you could be asymptomatic for so long. This one, if you get it, its incubation period is about 21 days. But once you have presented with symptoms, if you are not attended to, then it kills you within the shortest possible time.
Yes, now let's talk about which health facilities should suspecting, Ebola patients not Ebola patients until they are diagnosed, but, suspected Ebola victims head to, for immediate medical attention.
Any nearest health facility to them, and we are going to ensure that we provide a clear definition to all our health facilities. Already, a communication has been sent through the Director General Health Services for all health facilities to be on high alert.
And at the moment, let's talk about the health workers. What measures has the Ministry of Health put in place to ensure that they actually safe? We are talking about equipment and gears to, be worn to prevent them from actually contracting the Ebola virus from patients or victims.
Of course, now the levels of suspicion for the patients who present with specific symptoms should be high amongst health workers, and also to ensure that when they are handling patients who present with symptoms that are consistent with those of Ebola are covered in protective gear, and this protective gear has been dispatched mainly to begin with the areas affected in the Mwende district, but also working with national medical stores. All the districts that are at high risk, they will be provided with supplies of the Ebola protective gears.
Yes, now
infection prevention and control.
Now, reports are the Ebola virus that we are battling with at the moment is the Sudan variant, or rather the Sudan virus. Now, what are some of the districts that should be on high alert at the moment?
All districts around Mubende, Chiboga, Kamwenje, Chamkwanzi, all those districts that are surrounding, nearby, there are about 10 districts that are nearby Mubende, including Kampala and Wakiso. People should be very vigilant, but our teams are doing whatever necessary such that we are able to interrupt transmission. Our aim is to ensure that the virus does not cross from Mubende to any other district.
You're talking about you're trying to ensure that the virus does not cross from Mubende to another district. At the moment, definitely there are taxis, and people sit about 14 in taxis, and also borders that are transporting people from Mubende district to Kampala and other districts. So what measures have you put in place? Are you still emphasizing, as the Ministry of Health, are you still emphasizing SOPs?
Yes, highly that. We are drafting a number of guidelines, but even based on the previous outbreaks of Ebola, we have never instituted any travel restrictions, whether locally or internationally, and we have a system able to contain this outbreak, so there needs not to be any cause for alarm.
Okay, so Mr. Ainebiona, I would like to ask this. How long can one have the Ebola virus in their body before they finally pass on? Like, what is the estimate? How long can one live with it?
I'd say the incubation period is about 21 days. If you get into contact with an infected person, it can take about 21 days for you to present symptoms. But once you have presented symptoms and you've been confirmed, if you are not given any supportive treatment, you can die in a few days.
Okay.
It doesn't require a whole day. Yeah.
Okay, so I would not be doing the viewer justice if I did not ask this, and we did come across some of these concerns in our tweets, and a certain section of the public feels that the Ebola outbreak coming up in Mubende is a ploy by the government as well as the Ministry of Health. It has been alleged that you are trying to bring back the whole measures and initiatives of now it's lockdown. Do you think this is a situation that we might get into if Ugandans do not take the necessary precautions and measures?
For now, what I can say is that we have take personal responsibility. If there are people who are still doubting, I pray that they do not become victims, because once we report an infected disease, it has been thoroughly investigated and confirmed through Uganda Virus Research Institute, and already you see they are able to know which strain this virus is, and we shouldn't lose people like we have done in the past outbreaks, because there's a time when over 200 people died of Ebola. So we need to ignore those ones who are spreading false information as always expected, and assure Ugandans that if we follow the advice that has been provided by the Ministry of Health, we shall be able to prevent and control this outbreak.
Now, yes, some people have suggested that the people who attended the Nyege Nyege festival, recently concluded, it was attended by about 12,000 people. So the suggestions are that those people be quarantined. So are you having any plans of quarantining any people at the moment?
No, there is no link between the Ebola outbreak and the Nyege Nyege festival. So that is not necessary.
So do you think that the particular people who attended the Nyege Nyege festival should be on the lookout?
No, because really, when you look at where the case was confirmed and where the event took place, these are two distant and related places. So there is no need to worry for anyone who attended Nyege Nyege. So like any other person, everyone has to be on the lookout for people who present with symptoms consistent with the Ebola virus.
Okay, so Mr. Ainebiona, representing still a section of the public, I would want the Ministry of Health to put their word, because like you say, this is not the first time, this is actually the 5th time that we're having an Ebola outbreak in Uganda. Of course, the most terrible one being the one that happened in 2000, where we lost quite a number of people. So my question is, if this situation is to escalate even beyond the Mubende borders, can the Ministry of Health in Uganda be able to contain the outbreak?
That is our experience as Uganda. Uganda is known for preventing these viral hemorrhagic fevers like Ebola. And as you have stated, this is our 5th outbreak. And all the previous outbreaks were, apart from the one of 2000, we have been able to contain them in a possible record time without losing many people. Because we had a scare in 2019, 2018 around the Kasese area, when we had a family coming from the DRC, and all those were able to be quarantined and isolated, and we did not have the infection spread to any other part of the country. So our health system has been tried and tested, and we have the capacity to contain this outbreak.
Now, should Ugandans prepare for any financial implications in case they are, they are confirmed to have contracted or, contracted the Ebola virus?
Whenever there is an outbreak of this nature, of the viral hemorrhagic fever, and you have been admitted to a public health facility, this treatment is offered free of charge by the government of Uganda.
Okay, and also I would like to know, are private hospitals and medical facilities allowed to treat Ebola patients in case they receive any of them?
We are going to provide guidelines. This is a highly infectious disease. We have an isolation facility in Entebbe. We have an isolation facility that has just been constructed at Murago. So we will be working with all the health practitioners to see how best to manage these cases. But in case of any case reported, for instance, like in Mubende, they have to be managed at the Mubende Regional Referral Hospital, where an isolation point has already been established.
Okay, so Mr. Aineviona, another question that I'd like to pose to you is in regard to handling of Ebola cases while at home. I mean, for people who have been diagnosed, when you go to the hospital, is there a mechanism if someone wanted to stay at home? What are some of the home remedies they can use to treat someone who is suffering from Ebola, or is it not advisable?
The nature of transmission of Ebola, it's not advisable to do home isolation at the moment. Yes.
Yes, and also let's talk about some of the measures that the Ministry of Health is putting into place to mitigate this Ebola virus before it can, escalate into a bigger pandemic, maybe.
I've already highlighted this. That's why we have a team on ground. That's why we are doing risk communication. That's why we are doing case listing, contacts of the confirmed case, contacts of those contacts, and also ensuring that we investigate any unconfirmed deaths that have happened in the recent past. So those are the measures we are doing at the moment, ensuring that in case there are any persons who are presenting with signs and symptoms, they are all isolated in one point.
Yes. Dr. Diana Atwina yesterday gave the nation a toll-free line that, an individual can use to contact the Ministry of Health in case they have any suspicions of an Ebola patient. So would like for you to re-echo it, for the viewers out there so that they can take note of it.
Yes, we have a fully-fledged call center with call center agents who have been equipped with information. In case you have a person who is presenting signs and symptoms, please be quick to report that suspected case such that our teams can come and identify them and also take them for isolation. And our toll-free line is 0800 100 066.
Mr. Aineviona, finally, on the side of the parents, some parents have shown concern and in regard to the fact that children have just reported back to schools. And of course, with the first outbreak of Ebola being presented in Mubende, some parents are concerned and saying, okay, since Ebola is spread through person-to-person body fluids and these children are at school, would it be in their best interests for children to be recalled back home? Or is that something that the Ministry of Health is not thinking about?
That is not necessary at the moment, because we haven't had any history or according to the investigation of a school-going child. But we will keep you updated as per the process of contact listing.
Okay.
And we will also be subsequently announcing additional measures if they are necessitated by the situation.
Yes, and Mr. Aineviona, as we wrap up this interview, would love to know from you, are there any travel bans at the moment, for Ugandans traveling to other countries? Are there any travel bans or restrictions, or there are none in place, or the Ministry of Health is planning to put some in place?
According to the World Health Organization and also the international health regulations, there are no necessary travel bans in regards to Ebola. And this has never happened. Whenever there is an outbreak, we always ensure that we have screening for people going out or coming in, and no travel bans really are necessary. So it does not need to put in travel restrictions.
We really do hope so, because we do not want to see a case scenario as to like what happened when we had COVID-19, because if the strain or if the virus that we're seeing is that one that has been also seen in Sudan, I would maybe say, or the public would maybe, one of the initiatives being put in place would say, can we put a travel ban on Sudan, like people coming from Sudan and people going to Sudan? It wouldn't be advisable. So that's the situation is contained until further notice.
Travel restrictions are not necessary at the moment.
Okay.
Well, thank you so much for joining us, Mr. Aineviona, on Sunrise at Sea this morning.
Thank you for having me, and have a good day.
Have a great day to you too. Well, we've been joined Mr. Emmanuel Ainebiona, and that is the Senior Public Relations Officer from the Ministry of Health, and he's been weighing in and answering your questions in regard to the Ebola outbreak in Mubende district at the moment. So Shivan, according to what the Public Relations Officer from the Ministry of Health has confirmed, do you think that Ugandans should still panic about this? Or for me, I get the picture that it's actually containable at the moment.
Is it? Is it?
I don't know. That's really the picture I get from him.
I would, for a moment, I want to move away from just being a journalist and be an investigative journalist. Is it a picture they're painting for us? Or is this situation actually something that is going to happen like what we had in 2000 or in 2016? And like among the questions, the valid questions that I asked, and these are still concerns that have been raised by the public, when it comes to some of the contingency measures, are we looking at our children who are in school? Because this is an absolutely fertile breeding ground for the Ebola virus to be transmitted. So is that something that we are looking at? But he also went on to mention and say travel ban is not something they are looking at, but the strain that we have is coming from Sudan. Isn't that something that we should be worried about? He talked about screening and all these things, but still these are things that we're doing during COVID-19 and the virus spread through truck drivers. So my question is, what makes us think that history will not repeat itself?
Well, I don't know what measures. I think he seemed to be very, they are very confident and are convinced as the Ministry of Health that the measures that they have put, the precautionary measures they've put in place will actually work. But I do understand or get where you're coming from when you talk about, students, because at the end of the day, in Mubende district, they are day schooling children. Exactly. Is that what they call it? Yes. So if one of them has been in contact with someone who is infected and then they head over to school, probably they are going to a school that's day and boarding as well. So you're infecting a number of students there. So what you said is actually very important. But I think at the moment, on the look of things, just like the PR of the Ministry of Health has talked about, I think they're taking it a little bit, and maybe they're not taking it lightly, but they don't want to cause panic among Ugandans.
Listening to him this morning, he's very confident. So that alone, I'm sure, has put the public at rest. But again, let's look at the side of the vaccines. Now that we have this strain from Sudan, do we have a vaccine that is able to contain, and are the vaccines
We don't have a vaccine. Earlier, the one tweet that we read, there's a gentleman who said there's a vaccine that was manufactured and it's in Canada at the moment. Yes, it's in Canada at the moment, and they say that this could come in handy right now. With this Sudan virus that hasn't taken over Uganda yet, but yes, that's what we're battling at the moment. So. Well, I don't think we are at the point where we need vaccines. And one thing that the Ministry of Health yesterday talked about when it was trying to calm Ugandans down, they say that we have been through this before. I remember there's a time when there was an Ebola outbreak in the Rwenzori region. That time I was actually in Fort Portal. My goodness, the panic was a lot, and it was in Bundibujo district. Very many people passed on due to the virus, and also a number of people in Fort Portal district also passed on. So it was a lot of panic, and yes, a number of people died. So, well, saying that it happened before and we overcame it, we shall overcome it again. Yes, we shall overcome it again, but let not history repeat itself. So let's learn from the mistakes that we did in the past, the things that we did not do in the past, and implement them now so that it doesn't get any worse.
Yes, but also still in relation to that, and earlier on I talked about vaccines. Well, some of the vaccines that were approved by the Food and Drug Administration, that is in the US, is called the Ebola Zaire vaccine. Of course, like you said, the vaccines and the viruses are named to where they were first discovered and where they were made. So this one is the Ebola Zaire vaccine, and it was approved by the US Food and Drug Administration for the prevention of disease called the Zaire Ebola virus in individuals 18 years of age and older as a single dose administration. So actually those are among the vaccines that have been approved for the treatment of Ebola. Not for the treatment, but a vaccine that is given to make sure that you are kept intact and healthy.
Well, let's still get back to the tweet and see what so many other people are talking about this Ebola outbreak. Our next tweet comes from Dr. Faith Nabushao, and it says the Ministry of Health has today confirmed Ebola in Uganda. Ebola virus disease is often fatal. We all ought to be vigilant, and I concur with what she is saying. So as we wind up the conversations, yes, the conversations, because we had two of them. One was the interview with the public relations officer from the Ministry of Health, and then the other conversation that I was having with Siobhan. So, what of advice from you to the people out there, how to take care of themselves and you know, make sure that we curb this Ebola outbreak and we do not be plunged into a pandemic of sorts?
Okay, the first one is that Ebola is actually real. It's a disease. It's not witchcraft. So that is the first thing I need to, like, I cannot believe that in this day and era, there are people who still think that Ebola is caused by witchcraft. No, guys. Like, read so that you understand how these viruses are transmitted and how they can actually be cured. It's very important. Do not be redundant, because at the end of the day, it is your health that matters. But finally, I'll end by saying this before Aggie closes up the conversation. Well, Ebola virus can survive on dry surfaces like doorknobs, countertops for several hours. In body fluids like blood, water, and sweat, it can survive to up to several days at room temperature. So actually, this is more or less exactly what what we're being told in regard to COVID-19, that the virus can stay on a dry surface for up to 2 days. So please practice proper hygiene.
Anyway, as we wind up, let me re-echo some of you know, the signs and symptoms of the Ebola virus. One of them is fever, the other one is headache, the other one is muscle pain, vomiting, body weakness, the other one is bloody diarrhea or urine, the sore throat, and bleeding from body openings. And these have been put out by the Ministry of Health so that you take extra precaution when it comes to these. And also, we do see how you can protect yourself from contracting the Ebola virus. One of them is avoid direct contact with body fluids of a person suspected to be suffering from Ebola by using protective materials, and that is gloves and masks as well. So if you still have your masks at home, or if you don't have, it's about time you head to, you know, a pharmacy or, you know, shop and buy that mask. And the other one is persons handling the body of a person who is suspected to have died of Ebola should wear strong protective materials like gloves and masks. Now, this is not only for health workers, it's also for people who are going to, you know, be transporting probably this person from their home to the health center.
I like that you highlighted that, because Mr. Inebiona highlighted and said and clearly stated that it is not advisable for you to try and do home medication or home remedy while you're suffering from Ebola. The best thing to do is to actually go to a medical facility and be properly isolated and taken care of, due to the way that Ebola is transmitted, like Aggie has already mentioned.
Anyway, and this is very interesting, but it's very serious. You should take note of it. The other one is avoid contact or eating bush meat, especially from monkeys, bats, baboons, gorillas, and chimpanzees. This was put out by the Ministry of Health. I'm not the one saying it. So it's about time, if you have been consuming, you know, that kind of food, it's time that you avoid it and resort to something else. I mean, you can eat vegetables, you will not
die.
And this is the toll-free line that the Ministry of Health put out. I'll re-echo it. The PR of the Ministry of Health said it. Even yesterday, Dr. Diana Atwine gave it out to the public. But it is 0800 100 066. I repeat again, 0800 10 00 and 66. So yes, take note of it. You don't have to be infected to, you know, take note of it. I have it here. I think Siobhan has it as well. Everyone should have it for just in case of any eventuality. It's very important. Something else you have to say?
Finally, again, what Mr. Inebiona pointed out is how long, or the incubation period, which is about 21 days. So actually, the moment you start feeling the signs and symptoms, it is advised that you go and seek medical attention soon rather than later.
Exactly. So we have given you all the information, all the insight that you need or you needed in regard to this Ebola outbreak that was discovered in Mubende district. Well, that is all we had for you on the segment of the Twitter Jabs. Coming up is our views. Keep watching Sunrise at Sea and don't blink.